Hey everybody, Sean Keating here. I want to welcome you to the Dental Up Podcast Show by Keating Dental Arts. Today we have Dr. Eric Markowitz from Washington, D.C. Eric, what's up, dude?
Not much, buddy. How's it going?
It's going good. Thank you so much for taking your time to talk with us today. And, I want to thank you for all the work that you do with us. You're really a high-end practicing dentist. You're very demanding. Tell me a little bit about your practice. Did you take over Pop's or did you just start your own? Tell me a little bit how you started off, if you could.
I went in with him out of prosto school. He was a high-end general dentist, but didn't do as much with the reconstructive work and the implants. And I got trained after prosto residency. They had a 1-year fellowship for implants, so we did surgical placement of implants and all restoration aspects of it. So I brought that to the practice. We just kind of worked together for about 15 years, and then I took over the practice and grew it significantly, but started with his base.
No kidding.
When young guys come out, they ask for some advice about what to do and what not to do. And one of the good things to do is, go get continued training, continue learning new stuff, and go back to your office and try it out. But you also got to know your limitations, know what you're not so gifted at. And for me, one of those things was endodontics. I didn't enjoy it. Thus, I never took the time to get good at it. So I don't do it.
Absolutely. How's that work now? What's the etiquette of, because my brother, he tells me all the stories with him. He's in a town where a bunch of GPs in there and just a few practices limited to endodontics. He's an endodontist and take, certain dentists out that, do refer and stuff. How do you do that with who you refer to? You know the guys, or do you meet up with them? Do they kind of woo you a little bit? Some new guys coming into town and say, hey, I'm going to try to get Dr. Markowitz to refer me my endo, to refer me my, perio, refer me my, oral surgeries. How's that work?
The guys who are true one-dimensional specialists, only doing limited to their specialty, they really have to do an awful lot of legwork. They relevant to be there when you need them and meet all the new folks. And, they keep hustling until they get you to work with them. Same as probably you have to do some of that stuff with your laboratory. You and I, same thing. Several years back, I got referred to you, gave it a chance, and it's become a great relationship. Same thing with those guys. They got to get you to send them a case or two, and if there's good chemistry, then you continue on. If there's not, then you cut bait and you move on to the next.
Now, do you think you'll be out getting into another second and third practice in the future, or what do you think?
I don't think so. I'm a quality-based, not quantity-based kind of guy, and I think for me that works better. I'm a bit of a micromanager and particular about what I want and how I want it. And if you start having multiple places and you're relying on multiple people to do things the way you want it done, but you're not there, to me that kind of is looking for trouble. If you know yourself to be someone that wouldn't like that, and that wouldn't really work with my personality very well. With a lot of folks it does, and quite frankly, they end up a lot more successful. But I just don't think I would enjoy that. In terms of staffing 3 offices and all that, it's really a major headache. It takes away from what you're focused on doing, which for me is doing the best I can to provide high quality dental care. And I can't do that if I'm getting called away 10 times a day to put out fires in other locations where I'm not even at.
Yeah.
That just it's too distracting.
Absolutely.
For me.
Oh,
for me. Some folks like that. It's just not my style.